Hello, everyone. The title of my research is The Effects of Different Additional Therapies in Cerebral Palsy. My name is Márk Pulay, and I graduated in the András Pető Faculty many years ago. And my vision is that Pető method contributes to better quality of life of patients with cerebral palsy. And my mission is to implement and find new cutting-edge technologies and additional therapies which fit to the holistical approach of the Pető method. To reach our aims, or my aims, we set up three projects. One of them is a systematic review and meta-analysis. The second one is a pilot study. And the third one is going to be a pre-study protocol based on the experience of the pilot study. The title of the working title of the first project is the effects of additional whole body vibration in patients with cerebral palsy. But what is cerebral palsy? Cerebral palsy is caused by mostly perinatal noxa and characterized by abnormal tone, posture, and movement, such as hemiplegia or tetraparesis. We say that patients with cerebral palsy requiring lifelong therapies, such as physiotherapy or conductive education. And there are many additional therapies. And one of these promising therapy, or additional therapy, is the whole body vibration. And you can see on this figure that this vibration platform can be used in different body positions. Our aim was to evaluate the effects of this additional therapy, especially on musculoskeletal system, in patients with this patient population. So the P is already described. I is those who get any kind of conventional therapy plus this additional whole body vibration. C is those who get conventional therapy. And as you can see, we have many secondary outcomes as well. We conducted a systematic search, and finally we got 24 eligible full text. Before I start to show you the results, it's important to know that there is a classification of patients with cerebral palsy. There is 5 different levels. The first level, we can say the most independent level, and the fifth one is the less independent. And based on this classification system, there is a gross motor function measurement which contain 5 different domains, and these domains can be used independently, and the scale from 0 to 100, and the higher number corresponding to the better function. The first results that we find in this additional therapy compared the whole body vibration training and control group in muscle strength, which was measured with dynamometer on the lower extremities. And we can see that there is an absolutely clear tendency that the muscle strength increased in the intervention group. The second outcome is the spasticity, which is very important when we are talking about cerebral palsy, which was measured with a ASFORS scale. You can also see a description about this scale. It's 6 different scales. In that case, the favor of intervention is the decrease of spasticity, and we can see also promising tendencies in the increase of spasticity. The third one is the 2 domain of the GMFM, the D domain, which is the standing, and the E domain, which is walking, running, jumping, so dynamic parameters. In the first one, we make visual subgroups because we find that those studies who involved patients with higher pro values, it means better condition, they can reach or they can develop quicker and reach higher post values as well, compared with the other studies who involve patients in another physical condition. The last 2 outcomes, which is also walking or dynamic parameters, so walking speed measured by centimeter per secondum, or the 6-minute walk test. We can also see here promising changes in both domains. To summarize the strengths of this study, we involved only RCTs. We find new results compared with the previous meta-analysis, such as spasticity or changing in spasticity, or also more detailed walking parameters. And there are, of course, many limitations as well, such as high different baseline values or the age differences even in childhood. It's matter that somebody is 2 years old or 17 years old. To summarize, due to the promising effects of this additional therapy, we considered for inclusion in conventional rehabilitation program, but more studies need to investigate the effects of this additional treatment in different type of cerebral palsy. This is the progress, and we are trying to submit this paper in the Journal of Movement Disorders. The second project, which is a pilot study, investigate in another additional therapy called pulsed electromagnetic field therapy. It has already convincing experience in different disorders with abnormal muscle tone, such as SMS. But however, there is no evidence of this therapeutic approach in CP population. And our aim was to assess the beneficial effects of this additional therapy on symptoms associated with cerebral palsy. Therefore, we start with a pilot study. It was important. This is a single-centered study. Was conducted in the András Pető Faculty Elementary School. The age was between 8 and 12. The conventional therapy was, in that case, conductive education plus this additional therapy. In the C, those children who get conductive education plus the placebo or sham device I will describe. And the primary outcome was overall stability. Of course, we set up inclusion and exclusion criteria, exclusions such as a patient with epilepsy or shunt. Here you can see the protocol drafting, the design. As I already told, this is a single-centered, randomized, double-blind, and placebo or sham-controlled clinical trial. You can also see the used intervention and the picture about the device. This device was placed on the lap of the patients by sitting, and they also put their hands on this device. In the case of placebo group, the device was not turned on. Finally, we include 12 participants, and we use different measurement techniques. As a primary outcome was the balance or stability. So we use the stabilometry. We find significant changes in some tasks, but due to the small amount of participants and the intervention, the time of the intervention, it can be understandable. But most importantly, I used to say the pilot study, it's a kind of technical pilot study, because first the main aim was this pilot study to see the dosing, how the dosing, the intensity, and the frequency of this therapy can be used in this patient population, and also to find how we can integrate this additional therapy to the therapy plan. The strengths of this pilot study, that this is the first RCT with this patient population. Of course, there are some limitations that I already described, and more RCTs are needed to specify the duration, the intensity, and the frequency of this therapy. We are in this progress, And to summarize, here you can see again the title of our project. And thank you for your attention. If you have any question, please free to ask.
Between your outcomes, there was the bone mineral density as well.
Bone mineral density?
Yes.
No. It was among the outcomes, you mean, but the results on forest plot, not.
Yes, I know. That is my question. If you found anything related about this?
Yes, there was some study which investigated to this outcome, but there wasn't enough data to compare in a flow or a forest plot. But in the results part of the article, I'll also describe a little bit more about this outcome. So there are some studies, some results, but it's statistically we cannot analyze those results. Thank you.
My question is regarding the assessment of the spasticity. If I remember well, you mentioned the S4 scale on the second forest plot. And I was just wondering, is this scale able to make an objective assessment or to make a comparison based on this scale's results?
Yes. Thank you for this question. It's a big question. This is a kind of gold standard, but it's of course contains some non-objective. It can contain some not objective parts because it's measured by physical assessment, so not with a device or the medical device. So this is why we suggest, or we also tried a new palpation, digital palpation, which is a soft tissue assessment device for spasticity. So it can be the new gold standard in the future, hopefully.
That sounds very good. And then other question, is it a self-developed method or it's internationally available, validated? Can you please?
Which one do you mean?
The second one, which the electric...
Yes, this digital, yes, this is actually a device that you can also order. There are some company who producing this device. It's like a mobile phone, so it's a small one.